you so much for coming with me, honey. I really appreciate your coming to this appointment. You know, I really haven't been feeling well lately.
Yeah, I know, Mom. You've been feeling really awful, and you really seem like you've been down in the dumps.
Yeah, a little bit of that too.
Excuse me, I'm sorry to interfere, but I just overheard that you were talking about how you weren't feeling very well. And, you know, I take a lot of stuff that I think really help me. And, oh, let me find that one. St. John's wort. St. John's wort is something that's very good for depression.
Oh.
So I like to take that one, okay? Licorice. I really like to take licorice because that really helps with, like, you know, menstrual cramps and things like that.
Okay.
Garlic, it is so good for your cholesterol. I mean, we already heard doctor's office, right? So that would be fantastic. And also, I like ginseng. Lots of energy. And it's so good for energy. And I also have to say, ginkgo biloba. I don't know why I take it, but I do anyway. So I really just thought that these are great things that you could try.
Yeah.
So, you know.
Thank you.
I'm Mrs. Cam, so it's very nice to meet you.
Nice to meet
You know, I
you.
hope you have a great time.
Patient?
And I will take.
Daughter, are you two ready?
Yeah,
Yes.
we're ready.
All right, Mrs. Cam.
Hi, how are you?
You two can follow me. A lot of chemicals and that?
Actually, yes.
A lot of chemicals. Okay, and it looks like there's a family history of heart disease.
Yes, there is.
Right, and personal history, you have hypertension, AFib, hyperlipidemia, heart attack 3 years ago,
Yeah.
and it says you were a smoker. Have you since quit?
No, I smoked for many years, but I quit after the heart attack.
Oh, you did. All right, congratulations. And checking with medications, you are on digoxin, Lasix, and Toprol. Is that correct?
Yes.
Any change in your medications?
Nope.
No. Okay. So what is bringing you in to see us today?
Well, I've just been feeling really lousy. Like I've nausea, vomiting, and my vision isn't very clear. Been a little dizzy.
Mom's been a little confused lately, too. I went to her house the other day and I asked what she did all morning and she couldn't seem to remember. That's not something that's normal for her.
Disorientation. And you said there's been a change in your vision?
Yeah, just things are fuzzy. Like there's even halos over things.
Okay. And what have you been eating lately? What's your diet like?
Well, could be better.
Be better? Are we doing fruits and veggies?
Don't really like those very much
Don't like
these
those.
days. So
Okay. I'm gonna just take a look here. Have you felt any swelling in your ankles?
a little bit.
A little bit.
A little bit
Okay.
swollen.
Check your pulses. All right. I'm gonna take a listen to your lungs. Normally I would do this under the shirt, but you know it's kind of busy today, so just take a few deep breaths. And one more. Okay, and have you been doing your daily weights?
Yeah.
Any change?
Yeah, actually I've lost a couple pounds. I mean, I've gained a couple of pounds lately.
She's gained a couple pounds, yeah.
Thank you, daughter.
Sure.
And you can take a, just lean back, I'm gonna listen to your heart. Okay, so feeling some nausea, some upset. Are you taking any antacids for the nausea?
No, it really just started a couple days ago.
And any issues with urination? Are you noticing any frequency, burning on urination?
No.
No? Okay. Are you feeling lightheaded right now?
Just a little.
Okay, you can go ahead and sit up and I will talk to the doctor and be right back in.
Okay.
Doctor.
Nurse, what's the situation?
50-year-old Caucasian female with complaints of nausea, vomiting, headache, blurred vision, and disorientation.
Background.
History of heart failure, AFib, hyperlipidemia, currently taking digoxin and Lasix.
What's your assessment?
Heart rate 60, respiration 18, blood pressure 136/85, temperature 98.7, SpO2 100.
And what do you recommend?
Check serum dig levels.
Very good. Let's get those tests ran.
I have those tests for you.
Okay. Hello, Mrs. Patient. How are you doing today?
Good. Well, it could be better.
Hi, I'm Mrs. Doctor. I got the results to your lab. You are experiencing some digoxin toxicity.
Oh.
Toxicity? My mom's on digoxin. What's even in that stuff? It sounds dangerous.
Yeah,
We actually met someone in the waiting room. Her name was
That's
Mrs.
right.
Cam.
Oh, Mrs. Cam.
Yeah, I think, does she work here? Maybe she works here. She was telling us about some alternative things we could use. She was talking about ginger and ginkgo biloba and St. John's wort. Maybe stuff like that could help my mom so she doesn't have to take all these medications.
yeah. What about those?
Well, the thing is that the digoxin that you're on is FDA approved to help with the symptoms that you are experiencing from your heart failure, such as the edema and the shortness of breath. With the alternative forms of medicine, there isn't as much evidence to show whether they have any effectiveness or not, and there is some evidence actually to show that there is some interactions with your prescribed
Oh,
medication. So
okay.
it's always good to talk to your healthcare provider, someone like myself,
Okay.
if you are considering using something like that. The digoxin, since it's been helping with your heart failure symptoms, I'm thinking that you got the toxicity due to the low potassium, which may be due to the potassium-sparing diuretic that you were on. So I think we can go ahead and switch that to a different diuretic, and I think that will help improve your symptoms if you want to give that a try, and we'll closely monitor your serum digoxin levels and make sure you're doing all right.
Okay.
Okay, does that sound good?
And I can try to have more potassium in my diet too.
Yeah, I can have the Mrs. Nurse come back in and she can let you know some foods that will be rich in potassium that you can try to add into your diet.
Okay, sounds
Sounds
good.
Hi, patient. Hungry. Why wait? So I did want to check in a little bit with some of the things the doctor discussed with you. So we are going to be changing your medication. You were on the Lasix, which is actually wasting potassium. So every time you urinate, you're losing potassium from your body.
Oh.
We're going to move you to spironolactone. So this actually is going to be a sparing potassium diuretic. So your body is going to hold on to it. You got a little caramel right here. Looks good. With that new medication, you're not going to lose as much potassium, which does play with your digoxin levels and kind of, might have had something to do with those symptoms of nausea, headache, disorientation. That being said, we still need to increase potassium in the diet. It's an important electrolyte for your heart function.
Okay, I
Might
can
be
work on
some in
that.
there, probably a lot more in fresh fruits, fresh vegetables, avocado, banana, things like that.
Oh, I'll try.
Okay, you'll try. That's a good thing to include. So with that being said, another important factor when taking digoxin is monitoring your heart rate. So when your heart rate gets to 60 or below, it's not a safe time to take that drug, and it might indicate that you need to come in and see us. So I'm going to teach you how to self-assess your heart rate, and once again, if there's any issues, you'll call here and we'll get you back on track, okay?
Okay,
All right, so to do that, it's easy. We're gonna find our pulse here right along the wrist.
okay.
You might need to set the Snickers down. No?
I don't
Okay.
think so.
Okay, you hang on to that. So once you feel that pulse, and when it's great, you have a watch here. So you're gonna wanna count the beats every time you feel that beat move for a full minute.
Okay,
So you can go ahead and count for a full minute, and then if it's at 60 or below, that's when you're not gonna take your digoxin and you're gonna call your healthcare provider.
okay.
So just to make sure you thoroughly understand, why don't you go ahead and teach daughter so then we know.
Okay. So right along the line of your thumb, right about here, that's where you put
I'm
your
gonna
fingers.
put my fingers there. Okay.
And can you feel your pulse?
I can, yeah.
Okay, so you're gonna wear a watch on this hand or
Okay.
look up at the wall and count to 60.
Okay.
Count a full minute, and if the beats are lower than 60, then that would be when I would have to call the doctor and not take the digoxin.
Okay.
Perfect.
Great.
Excellent. Okay, did you have any other questions today?
Nope.
All right.
I don't
Thank
think
you for
so.
coming in. Hopefully we won't see you soon.
Okay, thanks. Well, thanks again, honey, for coming with me. You were very helpful.
Yeah, you're welcome, Mom.
On serum. Dang it.
We did talk to someone. I fucked this up.